Actor Bill Paxton passed away over the weekend to complications from heart surgery. He was 61 years old. Paxton reportedly had a history of heart problems stemming from a childhood illness. Dr. Tara Narula is a CBS medical contributor and joins us now. Tara, I know you don't know his specific situation, but I think a lot of people are looking at this and wondering. There were reports that he suffered a fatal stroke as a result of the surgery. How common is that?
Yeah, so I mean, it's hard anytime we hear about someone who's young, and he was in his 60s dying from what sounded like, a surgery, maybe routinely, maybe not so routinely.
Right.
In any case, strokes can happen postoperatively. It is usually rare with cardiac surgery. By rare, I mean around 1 to 2%, sometimes as high as 14% in some case series, but typically in the 1 to 2% range.
Right.
There are different causes for strokes. There can be strokes that happen in the operating room themselves and then postoperatively, usually within the first couple days. And the different kinds are either a bleeding type of stroke, where there's bleeding in the brain, or an ischemic type, where there's lack of blood flow or oxygen getting to the brain. And that can either happen from hypoperfusion, meaning there's just not enough flow getting to the brain, or from an embolic or thrombotic event, meaning that plaque either broke off from the aorta, the big blood vessel in the chest, the neck arteries or the head arteries, and caused a lack of blood flow, or an
Right.
embolic event where there was clot in the heart that broke off or went free from one of the chambers and went to the brain.
And what do doctors look for before going into, let's say, a procedure like that to know whether or not you are at risk?
So most surgeons will ask that a patient has preoperative clearance or evaluation, depending on the type of the surgery. And we usually categorize surgeries as either low, medium, or high risk surgeries. And any cardiac or vascular surgeries are considered the highest risk. And so what we do, and I do this as a cardiologist, is risk stratify people. So you look at the person's underlying conditions. Do they have a history of, for instance, diabetes, known heart disease, a prior stroke, heart failure, or renal dysfunction? Those things would raise risk of surgery.
Right.
In addition, you look at how functional they are. Can they walk? Can they do their everyday activities? And you put all of that together with their medical history, and you basically come up with a risk estimate for them. And that is what you tell the surgeon, and then they basically make their plan from there. So it's hard every time we hear this, and I think a lot of times when people have, routine surgeries, C-sections, cosmetic surgery, you think it's no big deal, but complications can happen.
Yeah, I was going to say, this is almost the reminder. It's a horrible reason, but it is a reminder to us all that all surgery, there is risk that goes with it, no matter what it may be.
Absolutely.
Tara, thank you. Dr. Tara Narula, we appreciate the time.
Thank you.